Hello, my name's Linda Reelan. I'm a Joint Commissioner Manager for Mental Health and Learning Disability Services across the whole of Sunderland. I'm here today to tell you about a primary care programme which we launched back in March 2017 to all general practices across Sunderland. We are going on further after this to develop opportunities for training for practices around health checks, ensuring we have quality health checks across all of our practices, because that's very important to us. We developed a primary care steering group which is fully represented across the whole of Sunderland. We have a number of different clinicians on the group. We have nurses, we have healthcare assistants, we have receptionists, we have practice managers. We also have a liaison nurse who works with us in a specialist role, Ashley Murphy. We are supported by an executive practice manager called Eric Harrison and a clinical lead, Angela Lockyer, who is also a nurse within one of the practices in Sunderland. This work is all being brought together and linked in with the quality premium work across Sunderland. You all have one of these in your practices. This is an information document folder which the Primary Care Steering Group all worked very hard on pulling together useful information and tips for clinicians and non-clinicians within your practices. Just ask your practice manager if you want to see yours. Have you ever wondered what it's like to have autism?
My name's Matthew and I'm autistic. I just want you to take a minute to think about people with autism coming into your doctor's surgery and what they might feel when they come in and what problems they might have. When they come into your doctor's surgery, they're going to have a lot of noises surrounding them. They're going to see a lot of things. It could be lights, could be people, could be anything. They could even smell stuff. And for people with autism, these senses can give them overloads and it can overwhelm them and it makes them hard for them to come into doctor surgeries and it gives them a lot of anxiety which can sometimes stop them from coming into the surgery. So today we're going to give you some information about people with autism and learning disabilities and hopefully it's going to make it easier for them to come into your surgery and to get the care that they need.
This training is to improve the healthcare we provide to people with learning disability and or autism. In 2012, the CPOL report, that is the confidential inquiry into the premature deaths of people with learning disabilities, identified the need for improvement in healthcare and disease identification. If we get this right, we can reduce the premature mortality of people with a learning disability and or autism. CPOLD actually identified that 43% of patients with a learning disability die prematurely. Autistic people who also have a learning disability die 30 years earlier, and those without a learning disability die 15 years earlier. There are so many reasons for us to improve access to healthcare, and we need to get this right.
Hello, I'm Carol Rutherford. I'm a Director of Autism in Mind, and we've been commissioned by Sunderland CCG to provide low-level preventative support for autistic people in Sunderland. Autism is a lifelong developmental disability that affects how a person communicates with and relates to other people and how they experience the world around them. Autistic people see, hear and feel the world differently to other people. I think what I'd quite like everybody to take from today's training session is that regardless of how verbal someone with autism appears to be, that does not diminish the impact that the autism is having on their life, and that everyone with autism has a communication impairment. Everyone who has a diagnosis of autism has got a communication impairment. It doesn't matter how verbal they might appear to be when they come into your practice. It doesn't mean that their autism is not affecting them and that they can process everything that they are saying or is being said to them.
What does autism look like? I want you to take a few seconds out and look at some pictures. I want you to guess who you think is autistic and who's not. The only person on those photos that wasn't autistic was the lady in the top left. Now, you might have felt a bit uncomfortable during this activity because it's not right to guess how people are just by the looks and what their abilities are. But we do this quite a lot without realising that we might think that we don't judge people by the looks, but subconsciously we do a lot. And it's important when you're dealing with somebody, just because they look okay, because they look like they're not anxious or not stressed, to assume that they're okay, because inside they might not be. They might have lots of anxiety, lots of stress, and they might just be putting on a show for you, and that might not be how they really are. Now I'm going to talk to you about issues that people with autism face when they make an appointment to go and see a doctor. The biggest issue that people with autism face is anxiety and stress. This is the biggest problem that people with autism face in daily life, and anxiety is the number one reason that stops autistic people from doing things. Anxiety will most likely be the main reason that people with autism don't attend doctor's appointments, because they feel too anxious. This is something that needs to be taken into consideration for people with autism to make sure that they can access GP surgeries. Another big problem with autism is mental health issues. People with autism are 9 times more likely to attempt to commit suicide than the national population, and people with autism have a 70% chance of having one mental health condition, while 40% have 2 mental health conditions. This is something that should be taken into consideration. People with autism are much more likely to have complex mental health issues with them. Just because someone is high functioning and very verbal, this does not mean that they do not have any difficulties. Just because you're high functioning autism, it doesn't diminish any of the impact that your autism has on you. It just means it affects you in different ways.
When we carry out these health checks, we need to be mindful of the fact that patients with autism and learning disabilities also have comorbidities. Patients with autism have a 20 to 40% increased risk of epilepsy. They also have gastrointestinal problems. They can have hypermobility, eating and sleeping disorders, and autoimmune disorders. Patients with learning disability with comorbidities can also have epilepsy and SUDEP, which is sudden unexpected death in epilepsy. Someone with Down syndrome is prone to hypothyroidism and cardiac anomalies, and also premature dementia, and all patients with a learning disability are susceptible to premature deafness. We also need to be mindful of the STOMP agenda. Sunderland are working collaboratively to assist general practice in coordinating this approach. STOMP is basically an agenda to look at drugs that patients are on and stop or reduce inappropriate medication.
So what do we actually mean by a learning disability? A learning disability affects the way a person learns new things in all areas of their life. It affects how they understand information and how they communicate that back to us. We think currently in the UK 1.5 million people have a learning disability, and out of those 1.5 million, we think 350,000 have a severe learning disability. There's often a lot of confusion in jargon and terminology that we use, and sometimes we get confused between what is a learning disability and what is a learning difficulty. Any of you listening to this training session could have a learning difficulty because it's things like dyslexia or dyspraxia. However, a learning disability is not the same. It's inherited, it's a condition that can't improve.
What would the world be like if everything was the same?
What if all streets were pink?
Car, mini.
What will all pizzas be all like with all cheese?
What if all people were the same?
It would be blue.
We are all different.
That's make life interesting for all of us.
But just because we're all different.
We shouldn't be treated like unfair.
Let's celebrate our differences. It's what makes us us.
Hello, my name is Beverly Brown and I'm a self-advocate for people who have learning disabilities. I want you to have a look at these pictures and have a think who could have a learning disability. I understand that may not be easy for you to do, as you can't tell what learning disability looks like. The two people on the top do not have a learning disability, as the people on the bottom do have a learning disability.
I think it's good that we need to be aware that patients with a learning disability and autism have similarities. They can both have impaired communication skills, increased anxiety, behaviour that appears to be challenging. We need to be mindful of this. They may be trying to tell us something. They both have increased health needs and a risk of premature mortality, mental health issues and unmet health needs, which we're here to address.
So one of the things that we really hope to achieve by delivering this training to you is helping you understand what best practice looks like for somebody with a learning disability when they come along to your practice. So many of you will know that every practice presently has a learning disability register that we validate every year. We make sure we've got the right people on the learning disability register, so that means you can make the reasonable adjustments that they require. So anybody over the age of 14 is entitled to an annual health check in your practice. And like I've said, we want to make sure that the annual health checks that are delivered to people with learning disability are always of best quality. And that means that you need to make reasonable adjustments to the way that you deliver those checks. And we'll explore what reasonable adjustments are a little bit later in this training. The other thing that I want to mention that we're working on in Sunderland is making sure everybody with a learning disability and indeed autism in the future will have a personal profile. But we'll hear more about personal profiles later on. So like I've just mentioned, the annual health check is your one opportunity every year to really think about the health needs of people with learning disability. It's that opportunity to provide a holistic approach to their care. NHS England has just introduced a new template, and that's been built into all of your electronic systems now. The idea of that template was to take away all of the variation that exists, and hopefully the template will make sure that it's a top-to-toe assessment of the individual's health needs. So the good thing about the new annual health check template is it provides a health action plan, and that's done automatically. You don't need to worry about getting that from somewhere else. And what we want you to do within the health action plan is think about health needs that you've identified during the annual health check and really help the person with learning disabilities think about what those are. Beverly, can you remember when you had a health action plan? What was in it?
The health action plan really helped me because it made me realise what is good for you and what isn't good for you, and it made me have a good think of how active I could be when I do lose the weight, and it made us realise it can affect not just me weight, it can affect me life. I have a better lifestyle.
And can you remember, Beverly, who helped you with that health action plan?
I had support from Emma Reid and Helen, who are health facilitators, and Ashley Murphy, who was a fully trained nurse.
And do you have a health action plan at the moment or not?
I do have a health action plan which I take with me to all my appointments, and all I do is just update it when I have a check-up every year.
We would also encourage you to make a referral to the health promotion team if that seems appropriate, and we have no problem with you contacting one of us just to talk through some of the issues, and then we can better support where that referral needs to go to.
So, what can you do to make your practice more accessible for people with autism and learning disabilities? So, when you're talking to people with autism and learning disabilities, use simple language. We don't mean talk slowly like this to people. What I mean is use small sentences and only talk about one thing at a time, and if needs be, let the other person control the conversation. People with autism can talk a lot, so that might be difficult, but if that's the best way to have a conversation for that person, then you should do that. Using easy read information is also really good for people with learning disabilities and autism. It helps them understand what a condition is, or what a medication is, or even just other bits of information that might need to know. Also writing stuff down, writing important points down if they're needed from their visit to the doctor's surgery will be good, because some people with autism and learning disabilities have short-term memory loss and they might forget what you've told them. Not everyone will need this, but if ask the person if they need stuff writing down for them, because they might say yes, and that might help them. You might need to give people extra time to process information. Some people with autism take longer to process than others. What it means is you might say something to them and they might be quiet for a bit, they might be quiet for a few seconds. That's not because they don't understand what you said, that's because they need time to think about what you said. That's very different. Not understanding and having time to process are two very different things, and that's something that you need to understand when you're talking to people with autism. If you ask them something and they don't reply straight away, ask if they've understood it. Don't just assume they've not understood it, because they might just be processing.
But some people might need a longer appointment as people have problems communicating. Some people may need a quiet room as they may have problems with anxiety, wondering why they have to wait so long, or they can't stand any noise. I'm now going to hand you over to Angela, as she's going to talk about the personal profiles.
As discussed previously, reasonable adjustments are a benefit to our patients coming into general practice. Therefore, we need to build these personal profiles where reasonable adjustments can be identified. We can do this by communicating with community teams, parents, carers, support workers. We can also identify reasonable adjustments that help the patients that need them at health checks and appointments. Now, Beverly and Matthew are going to show you their personal profiles.
On screen now is an example of a personal profile. It has been done around my needs, and as you can see, it has a list of reasonable adjustments that would need to be made if I visited the practice. It also has my personal details and any other information that you would need to know about me.
So, Beverly, it's really important, isn't it, that you have a personal profile when you go along to the doctors?
Yeah.
Now, I know there's a few things that are really important to you. The first one, you like to see a female doctor, is that right?
Yeah, I like to see a female doctor, so if I'm ever poorly, I can describe what symptoms I have, and they can understand it better, what's wrong with me, and they can do a few tests. And whereas if a male doctor, I would feel really embarrassed. I would get really nervous about it.
Okay, I think that's fair enough, isn't it? So the next thing you've said to me before, sometimes you struggle to read the information that they give you to you. So tell us a little bit more about that. What would help when you go to the doctors?
I like to have like easy reading, so I can understand things, what's going to be happening and what's going to be happening with me, so I'm not getting too scared or too nervous.
And I think one more thing you said when you have a personal profile, that sometimes you get a little bit nervous and anxious about waiting. Is that right? And where would you like to wait sometimes?
Having to wait for a long time sometimes can make me quite nervous and quite anxious, and a quiet room where it's not too noisy, where I can keep myself at a calm level, so other people are not looking at me saying, why are you so anxious?
Okay, so I think all those things that you've said are easy enough to happen, aren't they, when you go along to your GPs?
Yeah.
People with learning disabilities and autism might find it harder to wait for an appointment, or they might not like waiting in a normal waiting room. This should be considered. If they have to wait for a long period of time in an uncomfortable space, then it might increase the anxiety, making the appointment harder. If the patient has a poor experience of their appointment and the needs have not been met, then it could put them off from coming back to a practice again.
Autism in Mind supports individuals with high functioning autism and families living with autism in Sunderland. You can refer into our service by telephone, by email. The details are on our website. We're a solution-focused service. We do self-awareness and understanding sessions for individuals who are autistic. We also deliver workshops to parents and carers.
One of the things that people with learning disabilities often struggle with is not understanding information that's given to them, especially information around investigations, treatment, diagnostics, for example. So within Sunderland, the CCG provided some funding to develop a website. That website is called Sunderland Action for Health. On that website, you'll find lots of really useful information, both for parents, carers, and staff. If you look through that website, it's divided up into many sections, and the section you would be most interested in is primary care.
I really want you to spend time thinking about what you'll take away from this training. You need to reflect and think about how you're going to improve and change your practice. Take that away and think about one thing that you want to do to make clinical care or improvement to your service. Drop that to me in an email, one thing you're going to do over the next 6 months, and in return I'll send you a certificate for this training. Thank you so much.
Come on in, have a seat. Okay, looking at your notes there, I believe that we're going to be doing some blood tests today. Is that right? Yeah? Okay, do you want to take your jacket off and we'll just get on with them there? I've got everything ready. Just give me hands a wash there. Right then. You've had a busy day today?
Yeah.
Out and about, yeah? Okay. Right then. Let's have a little look. Okay. Okay. Right then. Nearly done.
I think I'm going to be sick.
Oh, hold us in, take a nice deep breath. Sure you're going to be fine.
I feel a bit thin.
Okay, are you alright with plasters? Yeah?
I'm about to be sick.
Can I get you to put your finger on there? Just, if you just take a nice...
I'm really going to be sick.
No, you'll be fine. Big breath, big breath. Through your nose. Okay, nearly done.
I'm going to be sick.
Wait a minute, we'll get this plaster on there. Keep that in. Big breath. Let's put this plaster on. Are you alright with plasters there? There you go. Okay, there's a sick ball just in case you need it. Alright, if you hold that, I'll let you get your coat on, Matthew. And you can, the blood results will be in touch if we need anything doing. Okay? Now get your coat on. There you go. There you go. Come on then. Okay? Oh, hello Matthew. Come and have a seat. How are you doing?
I'm okay.
Now, I believe we're going to do some blood tests on you today.
Mm-hmm.
Yeah? How do you feel about that?
I don't always like blood tests.
Okay. So what would be the best way to get the bloods off you today? What would you find would be helpful?
I normally feel a bit faint, so I'll lie down.
Okay. Right, so if we've got you on the bed, what about water? Do you prefer to have some water available?
Yeah.
Yeah? All right. Is there anything in particular about getting the bloods done that may make you feel a bit worse?
I don't like the feeling of it.
The needle?
I can feel the blood coming out.
It's also when the blood comes out, so it's not as much the needle. You're all right with the needle going in. Okay. So have you ever passed out? You
Yeah.
ever fainted? You have. Okay.
I've not been sick.
And you've been sick. So if we have some water ready and a sick ball. Okay. So you know what happens. You know we'll put the tourniquet around. That makes your arm a little bit tight.
I don't normally like that.
You don't like that.
No, it makes the feeling worse.
Is it because it's tight, too tight in the past, or are you all right having it on? It's just too tight.
It's too tight and it makes us feel the blood coming out more.
Okay. So how about if we do a trial, putting it on and not having it too tight and see how you feel? Yeah, we can take blood without it if we need to. It just helps us a little bit easier. Does that sound all right?
Yeah.
Are you happy to go ahead? Okay. Do you want to take your coat off while I wash my hands, and if you can get yourself onto that bed? Okay. So I've got some water here, Matthew. I always get some water prepared for you, and your bowl. We'll give you the bowl now, just on this side, just in case they need it. Now, are you all right at that level, or would you prefer to lie down a little bit?
I'm okay with this.
You're okay. So what have you been doing today? You been out and about?
I've just been to town and find some new games and
What kind of games have you bought?
it's an Xbox game, the new one.
Oh, right. Like Xbox tonight.
Yeah.
Are you alright if we go ahead with this? Are you telling me if it's too tight?
Oh, that's a little tight.
A little tight, okay, so we can just release it a little bit.
That's okay.
Is that okay? Okay. So what's your favourite game then with your Xbox?
I like Call of Duty and Minecraft.
Okay. Right then, so Matthew, I'm just going to put the needle in your arm now, okay? Are you alright? So do you do the talking over the headphones? Anybody
Yeah,
to
I've got a
copy?
few friends in
Have
there,
you?
yeah.
Okay. You okay? Alright. You've done really well. There you go. No, it's all done. Are you alright with the plaster?
Yeah.
Any allergies? No? Okay. We'll pop you a little plaster on there. And then we'll get you a drink of water. Well, you've done well.
I feel a little faint, but
Do you? Okay, we'll get you some water. There you go. Take that for you. Have a little drink. You feel okay?
that's better.
Yeah, do you know any more? Yeah? Are you still feeling a bit faint?
I feel a bit better now.
You feel a bit better now, so you don't feel sick anymore?
No.
That's gone off? Okay. Do you want to try and sit yourself down on the end of the bed and we'll just see how you feel? So bring your legs round. You okay?
Yeah.
Yeah?
I feel a bit better.
Well, if you're feeling okay, you're free to go. Okay, and we'll be in touch with you about your blood test.